In Iowa, an outbreak of Legionnaire's disease has turned deadly. The State Health and Human Services Department confirms one person has died amid nearly 24 confirmed cases. Officials say the person who died was an older adult who had underlying health conditions. Purpura spoke to the wife of a man diagnosed with Legionnaire's disease.
A Marshalltown man's scratchy throat.
At first, it was like a cold.
Took a turn Sunday evening.
When I took him to urgent care Sunday, he was not coherent. He couldn't hardly stand up.
By the next day, doctors at Unity Point in Marshalltown confirmed Sarah Moody's husband, Steve Moody, was fighting a rare and serious form of pneumonia known as Legionnaire's disease.
It doesn't seem possible, you know.
Thursday, the State Health Department confirmed at least 21 people are diagnosed and one has died from an outbreak in Marshall County. According to the CDC, Legionnaire's disease is caused by a special bacteria called Legionella. When people consume water or inhale a mist or soil with bacteria mixed into it, they can become sick, especially if they have a lung disease or other condition that can make their immune system weaker. But Dr. Jonathan Crosby, a communicable disease expert at Des Moines University, says for so many to become sick, there is one likely source.
The big outbreaks come from contaminated water sources.
But Marshalltown Waterworks tells KCCI it tested the drinking water supply. That came back negative for the 30 pathogens it tests for. But here in Marshall County, health department officials say they're still working to understand the source, leaving people like Sarah Moody wondering how her husband came down with the illness, but spared her.
We drink the same water. We plant the same flowers in the same dirt. You know, he doesn't go in stores. I just want to know how this happened, and so it doesn't happen again.
Health officials urge anyone with symptoms, especially older adults and those with underlying conditions, to seek prompt medical care.